And good afternoon, everyone. This is Dr. Priscilla Bowens and Dr. Kimberly Johnson Hatchett. We are with MD plus DVM, and we are so excited to have you today for our back to school special. And before we get started, we want to thank all of our subscribers. Thank you so much for joining us. And to those of you who aren't yet subscribed, please go ahead and click that subscribe button for MD plus DVM. Also, we would like to thank our sponsors today. We would like to thank Pet Nugget. We would like to thank Bowen's Neurology Locum Service. We would also like to thank the National Association of Black Veterinarians. And Kim, don't let me forget.
And Kindred Momentum.
And Kindred Momentum LLC. In Hammond Animal Hospital. So thank you so much to those who are our sponsors and help to provide information for everyone, to put our content out there, because we have so much to share with you today. And we're so excited because it's not just Dr. Kim and I today. We have a mom roundtable. And the reason we have this roundtable is because we have a back to school special, because there is so much going on with having to make decisions about what we're going to do with our kids. Right. Whether you are a working mom, whether you are a stay-at-home mom. And so I'm gonna give you this quick disclaimer that all opinions are our own, especially those of our panelists. But I'm gonna turn it over to Dr. Kim and let her take it away.
All right, everybody. So like Dr. Priscilla said, we have a lot going on. In the next few weeks, many of our children will be going back to school. Also, many people will be thinking about going back to work as well, those who don't have kids. So we need to think about what decisions you're going to be making and what knowledge you need to make the decision that's best for your family. So we all know that there's the CDC. So the Center for Disease Control has some tools out there that you can use. Specifically, they have a checklist that can give you information about your sense of comfort. And it really kind of gives you information that focuses your thought process. So you have a checklist for people who want to send their kids back to school, a checklist people who are thinking, I want to do virtual for my kids. And then there's a checklist for how you feel about the information that your kids are getting. So one thing that Dr. Priscilla and I were talking about was, the rate of disease in your area. So the information that the CDC has is not as up to date as we would like for it to be, but the information that's in your local county should be up to date. So what you need to do is think about where you live in the county that you live in and looking at those websites, the local websites, to really understand the amount and the prevalence of the virus in your county. So that's the big thing that we want to drive home, is that understanding what the disease rate is and the percentage rate of the disease, if it's going up or if it's going down. That's going to be one of the big things. And if it's consistently going down, that might make you think, okay, but if it's consistently going up or staying plateaued, then you might have another thought. So some of the other things you might want to think about, and so some of the big things that you want to think about is, the age of your children. Will your children be able to, is there a mask mandate in your county? Will your kids be able to wear a mask for a prolonged period of time? I have a 3 and a 5-year-old. Now the 5-year-old, maybe, she might be able to wear it. But the 3-year-old, we put a mask on her and then it ends up over her forehead and around, or she ends up putting it on her dolly as a backpack, and it's not going well.
Not on the doll. Not on the doll.
The doll has a backpack, but it's really her mask. So, those types of things. I mean, and Dr. Priscilla, you're in the same boat. You have.
I am. I also have 2 girls, a 2-year-old and an 8-year-old. And the 2-year-old was in daycare. They, everything had to shut down. I'm here in Texas, in North Texas. And the 8-year-old school also shut down in March. And my 2-year-old, even if we try to train her, she's just not a fan of wearing masks. So there are so many things, like you said, that play a role in making this decision. And I will say this, I took an unofficial poll on a DVM Moms Facebook page. There are over 13,000 moms. And I had over 300 comments shared with me about just the differences of what moms had to decide, like the
Right.
different things they had to take into consideration. Some of the big things that stood out was the school public or private?
Right.
Because your public school may have more kids, even though they may try to reduce their class sizes. What, like you said, Dr. Kim, the ages of their kids. We had some moms who are pregnant and also have littles, how
Hmm.
many kids they had. Some people had 4 and 5 children they had to think about,
Right.
whether they were essential workers or had to work or not. I mean, because some people, while I'm a licensed veterinarian, I'm also a licensed attorney, and I am privileged. I am privileged to be able to work from home at this stage. But a lot of moms in the healthcare field and other professions cannot stay at home, or they
Right.
may own their own business, their veterinary business or health or medical business. And it's just that if they don't go to work,
They don't
they
eat.
don't get paid.
Right.
So, and if they don't get paid, your kids might not eat.
Yeah.
So, some of the single mom versus not. Some parents, some moms are single. Also, special needs came up a lot.
Oh yeah.
Some of the the parents said, well, my child needs to be at school. I have to take the risk because they don't do well at home. And some parents said, my child is immunocompromised, so I can't take that risk. They're an asthmatic, or
Yeah.
the parent has concerns. So
Yeah.
there's so many things
So
to
many
think about,
aspects.
Dr.
So many
Kim.
aspects. So the thing is, what they also talked about on the CDC, and from a disease information standpoint, they talked about there's not a lot of information about the transmissibility of it with kids. They theorize that kids don't transmit it as much as adults do. But there's really some things that are so strange about this virus. Most viruses, we know that kids are like incubators. They just spread stuff. You kids come home and the whole house gets sick. But we don't really know what this virus is going to do when it's exposed to a large population of children, because the schools shut down so quickly in March. Most of us in this nation, our kids did stop going to school at the end of March, all of April. Now, my children have been back in daycare since May. And they are in a very small, controlled environment. They don't interact with any other kids within their own little pod of kids. The teachers wear masks, they all wash hands, they do a lot of stuff. So, knock on wood, there hasn't been much going on, hadn't been anything going on at the daycare my kids are at.
So you
But
guys you haven't been notified. That's great.
it is great. It's great, but it's one of those things where everyone is vigilant, because it behooves us all to make sure that our kids are safe and that we're safe, and that they have very strict measures that everybody follows. So that's the other thing, is everybody going to be as vigilant as
Right.
you are.
Right.
So with the daycare setting, it's a much smaller setting, and all the parents got to go to work. So all of us are making sure that our kids and that we are healthy. But
Mm,
in other settings, you just don't know. So
yeah.
that's the other, you talk about
Variable.
pre-existing conditions. You have to think about not only your child having pre-existing conditions, but if someone in your household has pre-existing conditions. If your spouse or you have diabetes or heart disease or asthma. And if the child brings that home to you, then there's so many things that weigh into the initial decision. But then in
Right.
addition to that, we were talking about this as well, is what if flu season happens
That's
and the
my thing.
virus comes back,
That's my thing.
and then we
That,
shut down again?
that's where I was concerned, because I'm different from Dr. Kim. Mandated actually in the area that I'm in and the school that my oldest daughter goes to, we're mandated to start online, and they pushed it back by several weeks, which I was very surprised that the school district did that, but they probably did it, and from what I understand, because they wanted to be more prepared. And you have to think about your teachers and your
Mhm,
all of
mhm.
the staff that works at the school too, and their possibility of exposure. So they pushed hers back 4 weeks virtual, and then parents have the option to choose what they'll do next. With my youngest daughter, I could send her to daycare if I wanted, but I'll be honest, compared to Dr. Kim, my kids brought home every condition and disease and had all the runny noses and everything last year. So, I thought, like Dr. Kim said, we're heading into flu season. You know, I don't want concurrent flu and COVID at the same time. Those are both respiratory diseases.
Right.
And my oldest daughter, while she's not a diagnosed asthmatic, she has had respiratory issues and has an inhaler and has had to use it.
Mm-hmm.
So, I really, I don't want, that's something that to me is too much of a risk as
Right.
compared to some parents say, well, what about the social and the mental health aspects as well? That's a huge concern.
Too.
A lot of kids are missing their friends. As much as kids say they hate school, even my 2-year-old, she would say one of her friends' names. And I did not realize that.
Yeah. Yeah. So, I mean, with that, I think we need to think about bringing on the mom panel because, I mean, again, check your county website, look at the transmission rate in your county where you live. So if you live in, St. Louis, you live in Kansas City, Dallas, Atlanta, North Carolina, Raleigh, all those places. If you live in those cities, look in your county and figure out what the transmission rate is. Talk to your physician, your primary care physician, and your pediatrician, and get their opinion and what their thoughts are as well.
Yeah, and I'd say this because we're still our waiting room is still filling up. Waiting room, no pun intended. Our waiting room is still filling up with our mom panel. But I wanted to go back over some things when you were talking about plans, Dr. Kim.
Okay.
What about contingency plans? What happens if parents are in a good situation where they say, well, I'm going to send my kids to daycare, to school, and we have college kids are going back. What if there's an outbreak where parents have to adjust? Like, what are they going to do? Like, what should they be? Should they be thinking about these contingency plans?
Oh, yeah. So that's the thing, that you need to have those conversations now. If you're married or have a significant other that's helping co-parent, talk about those contingency plans now. Get those plans in place. I know that before the pandemic happened, I actually had talked to my parents about what would happen if one of our kids got sick, or all the times. My big thing last year was thinking about winter and snow days, and what am I going to do if there's a snow day? So I talked to my parents about that as a contingency backup plan way before this virus came. And so I had already kind of forethought about that. But now we need to think about not only snow days, not only that, but if they shut down again because of an outbreak, or if someone in your kid's room comes up with symptoms, or they have to quarantine for so many days, making sure that you have access to testing, those types of things. So that is, those types of plans need to be discussed now.
Yeah, they need to be. I agree. So we're almost full with our waiting room. Let's go ahead, if you want to, and just kind of give the viewers an idea of who we have on. Do you want to start, or do you want me to get started?
Go ahead and get started. Go ahead.
Okay, so we have several wonderful mom panelists, and they're wonderful moms and wonderful individuals in their own right. We have Alicia Jones, who's a licensed attorney. She says she's also a home and child management for over 10 years. The reason I asked Alicia to come on, she's in the Atlanta, Georgia area. She actually converted one of the rooms in her house to help with the virtual learning, which I think is awesome. I'm not that cool, or did not have the forethought to do that. So I want her, she's gonna come on and show us a little bit about her room that she's developed for her kids. We also have, I'm gonna go through my list here. We also have Carla Rogers. She has a bachelor's and master's and is a full-time HR practice manager, mommy to 3 and wife. She's a Girl Scout leader and personal Uber driver to a 10-year-old, she says. Aren't we all? We have attorney Christy Williams. She's a full-time attorney, wife, and mother of 2, and very busy and active in her community. We also have Jacqueline Pogue. She is a wife, mom of 3, and she works in product development and marketing at Ford Motor Company. I don't want to miss anybody. We also have Leah Thomas. She is a registered nurse turned momager and creative entrepreneur. She has her MBA in nursing with a focus on healthcare management. And let me just make sure I introduced everybody I know is coming on, and I think I did so. So Dr. Kim, you want to take it away and introduce your panelists?
Okay, so first off, we have Ms. Melanie Anderson Moore. She is the Senior Director of HR Innovations for Bayer. She is mom of a great young man and is also one of my Peloton sisters. She pushes me to work hard and work out almost every day. We also have Miss Delaney Johnson. She has been on the show before. She is a palliative care physician. She is the mom of two great teenage girls. And so she is going to bring her opinion back about what she's going to do with her kiddos. And then we also have another guest that's been on the show before, Dr. Contessa Gray Metcalf, who is, we all know her from Married to Medicine, but she also is a mom of three, ranging from elementary school to preteen. And so she's in the Georgia area, which has a lot of race. And so she has an opinion of what she's gonna do with her kids. So.
And really quickly before we let everybody in, just like you said, we have moms from Georgia, Alabama, Texas, Missouri, Michigan, from everywhere. So I think this is going to be wonderful. We're so excited to have them on. I'm going to start admitting them now. We're going to bring them all in. And like I said, we're going to, everybody's coming on. We're so excited to see you all. Everybody's loading up now.
Can you all hear us?
Yes.
Everybody hear us?
Yes. Hi.
Good afternoon.
Hello, everyone.
Hello.
Hello. Hello.
It's so great to see you all. Thank you so much for joining us.
Yes, looking forward to it.
No problem.
We are going to start with Alicia. Alicia, are you there? Can we see her? So we're going to start with Alicia because she has transformed one of the rooms in her house to get ready for the whole virtual learning. And she's gonna show us the room real quickly. But what we want to do while she's bringing that on, Dr. Kim and I, we want to make sure that we want to ask everybody who's on if they could take a minute to share with each of you to please share your thoughts on virtual learning but virtual learning as opposed to in-person learning and what you chose and why. But before we get to that, Alicia, are you there?
Yes, I'm here.
Alicia, do you mind taking us and letting us know what's going on in your household and what you did with your family to prepare to get them ready?
This is my front door. It's my entryway into the house. It used to be like a living room, which was not very widely used and just a small entrance anyway. We had a small little love seat here. This is now the big kids table. This is where the middle schooler and college student do their virtual learning. And so this dining room table is on a rug. I literally dragged the rug, well, TJ did, drag the rug out here into the living room. And we converted the dining room into what the boys have named home class. So I put up curtains for privacy. I wanted them to be kind of closed in, but still have light. And at the same time, I could have the privacy to still roam my house the way I wanted to. Sorry, that's the front door. So this is basically my dining room now.
So what inspired you to convert that room to learning? Wait a minute. So you have things on the wall, right? Is this motivation? Yes. What is that? Can you go back to that, please?
All of it. So this corner, we have a little math, we have a learning clock and the schedule. And I have these little things all over the place. And it's different motivational things.
So you guys have started back, you're in Georgia, right?
Yes.
Okay, so how did it go?
The first day was not great. It was more so a capacity issue with the county. Initially. Some of this stuff y'all already had. I just brought down here, by the way. And the love seat that was in the living room is now like just a lounge space. the county had capacity issues, and
Is this internet capacity issues?
yeah,
Okay.
the servers.
The servers,
So
okay.
when the high school logged on, they logged on first. It was okay, everything went fine, but then when the elementary school, which goes next, logged on, the system started crashing.
Wow. Wow.
And yeah, so but the teachers are operating with so much grace, and a lot of the parents are too. So we got through the first day. Everybody got through the first day. A lot of lessons didn't happen on all levels, but it was okay. By day two, actually by the afternoon, the IT people in the county had the things, like up and running. So
So you're
they
still,
were able to get on to their Zoom classes and everything. And they still didn't do much because still people were having issues. I started having my own technical issues with my internet. And I mean, so it was rough. But the next day they were able to get on, log right in, and from the first lesson, they were ready to go.
wonderful. Well, thank you so much for sharing with us. I know you're
You're
actually
welcome.
painting at your house right now, so we're
I am. We are in our dry coat, drying the first coat, waiting to put the second coat on. Yeah.
yeah. So we're so thankful that you were able to share with us, and we are going to let you get back to painting and go ahead. And we want our panelists to go ahead and join in, and we want to get everybody's opinion. I'm canceling the share screen now. All right, so I want everybody to, Dr. Kim, did you?
So I guess I'm gonna go in the order in which I'm seeing it. So Dr. Delaney, you're to my right. Yes,
Okay.
my left, actually. So go ahead. Tell us what's going on in North Carolina.
So I live in the second largest school district in North Carolina, which is Wake County. And our area has opted to go do virtual learning at least until October or so. And they're kind of really playing it by ear. But that was the direction that I was going to have for my family anyway, because to me, there were just too many unanswered questions. And I wasn't getting necessarily all the detail to make me comfortable. Secondly, I live in a multi-generational home. So I had to take that into consideration, that I have seniors who are over the age of 65 sharing the same space.
Mhm.
And so that was a unique circumstance for me, but I'm sure that's not just unique for me as well.
Right.
And so for it, as much as I know that my children need that socialization, they need that interaction. I have one child who has ADD, and so that certainly is going to affect her ability to interact with somebody on a computer screen. Overall, for me, safety is number one. And until I really get a consistent message, until I get an understanding that the people in my community are understanding the seriousness of this and adhering to the recommendations about social distancing and masking, I really could not send my kids back in good conscience to school, even when they do eventually open them back, until I really get a good sense that everybody has a good grip on that.
Okay. So below you is Miss Christy Williams. Christy Williams.
Yep, mother of two. I have an 8th grader and a 4th grader. We're in the DFW area, and much like I heard before me, we have opted for virtual. Our district is all virtual at this moment. September 8th, students do have the opportunity to go to class in person. However, our family will continue with the virtual. Our thought is to do that at least through the holidays, and then we will revisit next semester starting back in January. And it was a safety issue. I'm not sure that our community has a good grip on it. I'm not sure our school district has a good understanding. And then not only that, my daughter, who is the 8th grader, we brought her in to actually help us walk through the decision. And she said, knowing how my school is and how students interact with each other on a normal basis, she wasn't comfortable going back in person. So that was it for us. That's all we needed to hear.
Okay. Okay, right below me is Melanie, Miss Melanie.
Perfect. Hi, everyone.
Hi.
I live in St. Louis, and my son, who is 9, going into the 4th grade, he goes to a Catholic school, so private school. And the options were either 100% in person or 100% virtual, with the teacher teaching both sets of kids at the same time. So we chose 100% virtual. I'm a single mom, so it was the decision of me and my son. I did involve him in the decision making for it, and he felt more comfortable at home. And but we did have to have the talk, right? Because fourth quarter did not go well, right, at home. It was new for everyone. But what I also told my son is like, look, you don't need me to read the emails from your teacher, right? Like, you know how to read, you know what you're supposed to do. So I'm gonna need you to step up to the plate and have some ownership in this as well, which he agreed and said, okay, mommy, I'll do better, right? So, but what's also going to be different is fourth quarter, the teachers weren't teaching. Essentially, they were emailing the parents saying, okay, here's what you got to do tomorrow. Thanks. Email me the homework. So I'm glad that they're actually going to be teaching. It'll be a set schedule, and that'd be better for both him and me, right? Because I didn't sign up to be a teacher, right? Like, I did not choose that career. So so that's going to be better. Now, I'm concerned, as my son is supposed to start school on Tuesday. Ask me, do we have a schedule? Ask me, do we have a link to anything? No. And we picked up all the books and everything on Friday, and I was like, okay, where's the schedule, right? Because I'm trying to plan my work schedule at the same time. And she was like, yeah, we don't have that yet. We're still working on it, but he should be prepared to log on at 8 a.m. And I'm like, log on to what? Because you don't have any links, right? They're like, yeah, we know. We'll have it to you by Tuesday at 8. And I'm like, okay. So I'm not very confident right now. But we'll see. We'll see what happens.
Oh, well, okay.
Kim always has good facial expressions.
I mean, it's so much going on. Okay, so let's see who's next. Leah, can you weigh in for us?
Sure. So I kind of look at this as a progression for me. Very back when my kids were a lot smaller, I always wanted to homeschool, but I was still working. They were really small. There were a lot of different reasons why we didn't do it at that time. And so when the kids went home and didn't go back after spring break, I really did. I was actually very excited that they were home. I'm a stay-at-home mom. And so I was really excited that they were home because I would get to see them more often. And I kind of took that as an investment time for me to kind of see how they learn, what's going on. And I already knew that they would probably not go back to school, that wasn't going to be an option for us, even though we don't have, my mother is here and my mother-in-law is here. And even though they don't live with us, they are pretty much they are kind of a nuclear part of our family, even though they don't live with us. And so it's very important that we see them throughout the week, which we were doing during the time that, everything was mandated. And so one thing that, and I also gave them the option. I said, hey, if you guys have to go back to school with a mask, things aren't going to be the same. The way that, you did PE, the way that you did lunch, all these things are going to change. And so I wanted them to see what that vision would look like before we went back into it. And they really said, well, you know what? I don't think I want to go back. And, we talked about it. And so virtual for me was an option, but it wasn't an option because the way that the school is doing virtual, I just didn't want my kids to be sitting in front of a computer for 6 hours. And they're talking about doing it more so almost like college, where they sit and they stream into their classroom and they are expected to be there for every curriculum, co-curriculum, whether it's art, music, even PE. We still don't know how they're going to do PE, but they're expected to be there. And so I felt like that would also create a bit more isolation, because when you're requiring a student to be part of something, but they're not really part of something, I kind of decided, I think that, you know, even though the socialization aspect isn't there, I really would like for them to have more flexibility. I would like for them to think about some of the other things that they want to learn while they're at home. And so we decided to do the homeschool route. We have not started yet, but that's what we're going to do.
Okay. All right.
PE online.
Yeah, PE online. It's going to be interesting.
That's kind of like a, well, you know, maybe a
Like, I guess
video,
your workout class online too, huh? Yeah,
maybe.
yeah, you can do that.
Okay, Miss Jackie, you're up.
Hello. I am in Michigan and I have
It's
3
not
children.
winter.
No, that's why I'm outside. There's not snow on the ground for at least 8 weeks. So I have 3 kids. One is starting high school this year, so that's going to be interesting. And the other 2 are in middle school. So they will attend schools in 2 sort of different districts for the first time. So our middle school kids are in a charter school that allows students to come over from any part of Michigan that they'd like. So if they want to attend, they can drive all the way from Flint or Grand Rapids to come to school, which was something we had to consider. You'd have kids coming from any part of the state to come to the school. And then our oldest, who's going into high school, is part of an international baccalaureate program that's a part of a consortium of 8 different school districts. So again, you would have students coming all over from all over this side of the state potentially to come to school. So tie that in with also, we're surrounded by 3 major universities. So we're going to have people coming in from all over the country very shortly. And I don't know how they're going to get college students to cooperate with social distancing. I don't know how that's going to work, but combining all those factors and the factor that I would be at home because my company probably won't go back. We won't return to work at least through the rest of this year. I'm assuming probably not until maybe this time next year. I knew I would be here. And although I was not a huge fan of the virtual learning in the past quarter, the only child that I think I really have to be on top of is my youngest, who will be going into 6th grade. So the schools did offer 100% virtual. And then the charter school that the middle schoolers are in offered a hybrid option. So that would be 2 days at school and the rest pretty much is virtual at home. And we decided just to go 100% virtual at home. We know that this virus is not contained. We are grateful for the governor we have here. You may have heard of her, that woman from Michigan. But we are appreciative for her leadership and are glad that we are at the levels we're at. But we also know that cold season and flu season and coronavirus will all be here at the same time. And we don't want to set ourselves up for something like that to get a triple hit. So my husband and I decided that we would keep the kids at home 100% virtual. And the schools also offer Chromebooks for each kid. So our daughter, who has her own laptop, is fine, but it was nice to be able to have some technology that the school would offer to fill in any gaps that students may have. So yep, that's what's going on in Michigan.
Just wanted to piggyback on what you just said. And thanks so much for joining, Jacqueline. You said the flu, COVID, and you mentioned a cold. The New York Times just had an article that called it the twindemic. But this might be tridemic. I'm just saying, because I mean, I'm interested to hear, what our healthcare professionals have to say about that. But yeah, it's coming. The fall and winter are upon us. Go ahead, Dr. Kim.
So next up, we're going to call on Dr. Contessa. what is going on down? Hi, what's going on down in Atlanta?
Yeah, so can you hear me okay?
Yes.
Okay, good. I was kind of wandering around trying to avoid the noise of the 3 children in the background. So, but yeah, but we start school tomorrow. Tomorrow's the first day. It was a little bit of a, you know, chaos essentially, because at first they were going to go to school. Actually, they gave us an option of virtual learning or in-person school. My daughter, the oldest one, is going to be in 6th grade, so she's going to middle school now. And she was very, very adamant that she wanted to see, have that whole change in class experience, et cetera, et cetera. And so we've been already training on the mask and those things. But Fulton County is the largest school district, and so they were concerned about if there is an issue in one school, then there's, they basically will have to continue to shut down. And that was my biggest concern, in addition to the major concern of the teachers. I am a physician, my husband's a physician. And so for us, we've been working the whole time. And we do have some help now with the kids. However, I did take this week off to essentially just create a sense of normalcy for them, because I think it's going to be challenging to even hire someone to have them understand what it actually entails, like having them sit at a computer from 8:15 until 2 o'clock. If you've never done it, how can you expect someone else to do it? So that was going to be a challenge, but our biggest issue is going to be 3 kids simultaneously trying to teach them and have them focus. And it's just, it's a challenge. I mean, I think, it's scary because, the whole issue of whether or not people are going to take the coronavirus vaccine when it does become available is kind of now, I think, blurring the issue about the flu vaccine, which is incredibly safe. And it's something that I think everyone should really consider to take. And I think now, because of all this kind of suspicion that's happening with the coronavirus vaccine, people are considering not taking that this year. But I think that's going to actually make this whole situation much more deadly than it has to be. And so, if anything, I think the message should really be absolutely, positively, this is not going away. It's not. Actually, now I think the cases are up in children, and kids are getting sick. There was unfortunately a 7-year-old child in Georgia who died recently. He had a febrile seizure and died by drowning in the bathtub. And so kids absolutely can not, so there is absolutely, yes, kids do have a mild illness, but one thing that does happen in children is they get febrile seizures. And so if they get a high temperature, they can have a seizure. And that doesn't mean they have a seizure disorder, that after the illness goes away, it usually they don't continue to have seizures. But that's the point. There are absolutely acute complications that happen with kids. And in Georgia, the schools that have been opening in person, a lot of the schools have since closed, and a lot of the parents and teachers are quarantined. So, I don't think it really, at this point, we don't have a good plan in place for kids to go back to school, because the expectation that people who were trained to be educators should now also become housekeepers and, keepers of sanitization and maintain, force kids to maintain social distancing, all while, being in charge of maintaining their lesson plans. It's just a lot to ask of someone who didn't sign up to do that. So I think it's my responsibility to, kind of hop in there and make sure my kids can be at the computer. And the teachers can do exactly what they've been trained to do, is to teach. And if that happens virtually, that's exactly the way it needs to happen.
Okay. And I think lastly, Miss Carla. I think you might be muted.
Okay.
There you are.
Can y'all hear me?
Yes.
I had to log off my computer. It started hourglassing.
Yes, and Carla, before you tell about your current situation and what you chose for your family, can you also, as much as you're comfortable with sharing, I know we have some attorneys on as well, but you have a background in HR, and Dr. Contessa actually mentioned, taking off a week to get ready, for prep her children.
Mm-hmm.
Can you share information that you have about the Family Cares Act or anything like that, so people can know what their potential options are in terms of taking off to get ready to prepare their kids for school if they need to? Yes, thank you.
So yes, all of that is covered under the Family Cares Act. Any time off needed for parents whose daycares or schools are closed and they don't have childcare, or some organizations like where I am working from home, I could do it, but it's not really an option. But to allow that time under that act in order to prepare and take time off as needed without fear of losing one's job because they're a parent and they have to take care of their kids. I mean, that's what the whole act was created for, to protect parents during this whole pandemic.
So you're saying that people who are employed should see what options they have.
They should definitely see what options they should have. I mean, honestly, I don't know any employer who wouldn't provide an employee time off to prepare their kids for school, period. I mean, the fact that employees are still coming to work and still working during this whole thing is a testament enough when they actually don't have to.
Right.
So most employers, if they want to be a best employer, show their employees that they care about them. I mean, that's something that's so easy to give. I mean, if one of my employees came and said, hey, I need to be off for a week or 2 weeks to get ready, I mean, that's not an issue. I mean, I would give them the time off. That's what the CARES Act, and even beyond the CARES Act, that's just the right thing to do from an employer standpoint.
Thank you. Do you mind sharing what you chose for your family?
So I am the oddball out. I am in Saraland, Alabama. We are an independent school district, and I chose in school. My daughter is 10, and she has now been in school for a week. They started school on August 6th, and so right now things have been going just as normal, homework in the evening times. One thing that I did to prevent her from, because before, of course, both my husband and I work. I can work from home, but it's not, I work in healthcare, in management, and that's not really feasible with all my employees at work. And then I'm at home trying to be a parent, and I expect them to be at work. So we, of course, did the 100% in school. Our school did have the option to do 100% in school or 100% virtual. They sent this out to us in end of May, June. So we knew this was coming. The school district prepared the entire time. The week prior to school, every day we received a message from the superintendent on what the protocol was going to be, what was expected of the parents, what was going to be expected of the kids. We still had in-person registration. They spanned it over 3 days. We still had meet the teachers. It was just business as normal, but of course with more safety measures, wearing our masks. I can say to people in Saraland, for the most part, we comply. I've heard a couple of people grumble about wearing masks, but I look at it like this: even if I didn't have a parent who lived right across the street from me, I just want to be considerate of other people. I don't know. My husband has a lung condition, and so it's like, just put on a dang on mask. That's the whole thing. Wash your hands. It was definitely an eye opener that you have to tell people that they have to wash their hands. But everything's been going fine. No issues. We did have a little scare at the high school on the first day. They did have one student who came to school sick. And of course, they quarantined 5 students, but after that, nothing else has happened. So most of the parents that I know whose kids are in school, we all have the same mindset. Of course, if my daughter has a fever, I'm not going to send her to school. I'm not going to expose other people's children, families, because I don't know their home life. And I don't know if a single mom could take off 2 weeks to be at home with her kid and quarantine for another 2 weeks or 10 days after her child is sick. So it's just kind of being considerate of others. But our community is small. So like everybody knows everybody. And I think that's why it's been successful here, because we were able to prepare and everybody knows what needs to be done. So we just get it done.
I like that. And just to let you know, some of our viewers said you are not the oddball out. Dr. Kim, actually, her kids go to daycare And we had a viewer say that they, their kids are back in school too. And I don't know if you guys were able to hear this, but before you came on, I did a kind of a straw poll on a mom's DVM mom site of over 13,000 members, and it had almost 400 comments. And it really was split kind of down the middle with parents who had made decisions. So I think this is kind of a group that may be more one-sided, but in terms of what's going on, I had people comment from Canada, Alaska, which I wasn't even clear about how their numbers were going. Like people were commenting from all over the US, and it really just depends on a lot of things. Now we want you guys, now that you've introduced yourself and kind of said what you've chosen, we'd love for you to just kind of weigh in on some of the factors that people said that they have looked at, like their children's mental health status. For instance, my daughter, both of my daughters, and the 2-year-old too, said how much they miss their friends. And my oldest is very active. She plays tennis. She does a lot of stuff. And so she talked about her friends. And what I wanted to make sure, we call her a mental health coach, which is basically a therapist. But we made sure she was able to talk to somebody about her feelings and concerns with not having her friends around. And then we try to have very, I would say, very, what you say? Controlled interactions with friends, because we feel like she needs that. And I know that may be taking some risk, but we try to have it as controlled as possible. So you guys, please just go ahead and weigh in. I won't say have at it, but please just go ahead and weigh in.
Well, Priscilla, I'm sorry.
No, go ahead.
So definitely understand the mental health thing, because the one thing I had to tell Malia before she went back to school was no hugging, because she loves to hug her friends. They love to hug each other when they see each other. But we came to visit you guys during the pandemic. People were like, oh, you're traveling. Yes. And then she just came from her best friend's house, so she's limited to where she can go. But just not for her mental health, probably for my mental health too, that she has people that she can talk to and hang with, and not, be cooped up in the house on Minecraft all day or YouTube watching people play with My Little Pony. So yeah, definitely controlled.
I think Dr. Delton, you were going to say something?
Yeah, for me, for our family, it's been a matter of just kind of keeping balance, knowing that the risk is out there, acknowledging it, but still trying to negotiate some level of normalcy to everything. So I have 2 daughters, one is 11, one's 13. They're active in sports. So over the summer, they were still able to participate, even though their seasons were discontinued. We were able to coordinate with some coaches to do small group activities. My older daughter's in volleyball, so we drive her 30 minutes out of town to some country town to this little volleyball field built inside a barn, as far as I'm concerned. And that really helps her to be able to connect. It's just when 2 or 3 other people, and my other younger daughter's in soccer, so that's an outdoor activity considered to be somewhat low risk. So we're just kind of playing it by ear and being prayerful and aware, and just kind of, one of the things I had to do also was just to speak up too, because if I'm bringing my child to your practice and under leadership of a coach, I want them to also have a commitment as well. So and sometimes they're not even aware. So if I see something, I'm very kind and nice about it. I'm like, oh, I noticed that you were congregating in a small room with no ventilation. And when I brought it to their attention, they were like, oh yeah, I'm so embarrassed. I totally agree. And so I would encourage people to feel empowered to speak up for your children on your behalf. You don't have to be nasty or ugly about it, but just sometimes a friendly reminder will just, because you just forget. I walk into the store sometimes, I forget to put on my mask. So we're just kind of in our heads sometimes. So that's where I am with it.
Yeah. I would second the mental health coach. I think I would be remiss if I didn't mention, and our mother is probably watching, Priscilla, that my mother, a licensed marriage and family therapist, has really conditioned us very well to reach out to others when we have things we need to talk about. So my youngest does have a therapist, which has helped a lot, because as much as my older two are able to discuss how they feel, and also how they feel about each other, a lot. um, my younger one is still learning your words and expressions, to really fill out what he's saying, what he's feeling, and what he wants to say. Um, yeah, I second that. And then also, like, that sense of normalcy is definitely something that we've tried to recapture, especially here in Michigan. We only have so many days of sunlight. So last week, my husband surprised us all, and we all went out to eat at a restaurant outside. Lots of spaces between tables, and it was the most normal thing we've done in 4 months. The kids hadn't been out really that much because we didn't. One, it took a while to get warm here in Michigan, but two, we just wanted to be safe with where we took them. So we've slowly started to allow them to go places that are big spaces or open spaces, but it kind of connects them back to the world, and they really have shown some appreciation. So before school starts, which the high schooler starts on the 24th, the other two start on the 31st. So we're planning on taking them out to eat again at a different place, to a new experience. It's actually a ramen noodle place. So they've never had ramen before. So just giving them a new experience, but also doing something very normal, to kind of bridge that, oh, hey, this is happening, but we also still can live our lives safely.
My experience has been completely different. I have a new baby. So I have an 8-month-old around here who, when all of this started, he was just over 3 months old. So there has not been a lot of anything normal going on around here. But the blessing that I have is that my older boys are so close in age that they don't miss a lot of the interaction because they have each other. And because we had such a busy life pre-pandemic, the idea of them just being able to go outside and ride their bike was just enough for them. The closer it got to school, they really wanted to go back to school in person. They really understand why that was never an option for them. But what I did try to do was I got them together on Zoom calls with their classmates. And sometimes only 4 classmates showed up. Sometimes 8 classmates showed up. But I think we did it 3 times. And they enjoyed that. And then they go back to playing with each other. And they do play with a few kids in the neighborhood. And the parents in the neighborhood, we talk. So we're familiar enough with each other. And half of them are in healthcare anyway. So we've been good about trying to make sure the kids are doing the best they can to be safe. For a while, everything was closed. All of our resources to go swimming, which is my older son is a swimmer, and then the parks wouldn't allow tennis lessons for the longest time. So those avenues really weren't available to us. And besides, we're not taking a whole lot of risk, especially with my asthmatic husband, my asthmatic son, and my new baby. So recently, some of those things started to open up, but it was right before school started, and doing that was crazy enough. But I must say, since we've started our virtual learning, I was pleasantly surprised at how quickly they fell into the school routine, because their schedule is so much like school. It feels normal for them. And they were really engaged as if they would be in class. They were engaged with their classmates when they got to go in the small groups in the side rooms and do their little projects together. They talked and they laughed, and they went and they, engaged and interacted with the teachers and other classmates, and they enjoyed themselves. And I heard them laughing. I saw my silly one making faces at the screen, which is what he does. So that made me settle into the virtual learning thing a lot better. And I kind of think they'll be okay, but I'm really not above reaching out to. I've actually reached out to a couple of people. One of my son's best friends his mom gave me a number to a therapist that she's using because she has what she describes as the only extrovert in a house full of introverts. So we try to get him around us, you know, every now and then so the boys can play and give her a little bit of a break. But building our village has been the thing that we are working on now to expand our circle a little.
Those are great points. Did anybody else have anything to share about that? Because we had a viewer question that I wanted to pose too. Go ahead, because I want everybody to share who feels like sharing.
Yeah, I was just gonna. Oh, sorry. I was just gonna say I want to be completely transparent. I think I maybe didn't communicate well. I was absolutely going to send my kids to school. My husband and I both are physicians, and we both work. And I do admire the fact that most people on the call have the opportunity to work from home. I've been doing some telemedicine, but unfortunately, we just don't have those kind of jobs. You know, right. I actually have been working in the hospital, and I think I was going to send my. So I'm probably a little bit more reflective of some of the other half of the viewers, but I was going to do that. And we go to restaurants, we've been, we do activities. And so we're really, actually I worked more during the pandemic, like the height of it, than I do even now. It's kind of backed off a little bit, but we've always kind of been out. We've been out safely, but we have not been pretty much homebound. My kids are enjoying Roblox and those kind of things. And so they actually prefer a lot of times to stay home and be on the computer, but I've actually made them get back in soccer. My daughter did competitive gymnastics, but she was doing cheerleading, but that actually is too much contact. And so I switched her back to just traditional gymnastics. And so they go to gymnastics, they're going to do swim team. And we have pods. And so our kids do a lot of socialization as far as the kids, and there is actually some people who just pulled up just now. So we have pods that we hang out with. And we do that because actually isolation kills. And so if people don't remember that, if they don't remember, you know, anything about how this is going, but isolation in particular does make people, it hides depression. It makes people want to drink. It makes people want to, you know, do some self-medication. And so reaching out to people, and sometimes even if you know, do a drive-by or go to a park and just kind of walk along each other, you know, side of each other, something like that, that actually does improve your mood. So it's going to be a challenge to continue to, especially with kids, to keep them apart, even though they're not, you know, school is just a big building and it's not ventilated and it's just hundreds and hundreds of people. But if you can do some way of putting, you know, 10 kids together and allowing them to, over the course of this, you know, fall, get them together where they go to the park or they see each other, that is going to really be great for their mental health. And you can save yourselves, for the people who are listening who don't have the money for, you know, they don't have free, you know, healthcare, or they don't have access to healthcare. You can do some self-therapy that way. So connect with some other families who also are working, and find some other kids who need to just get out, who are extroverts or who just are not tolerating isolation well, and get them out and get them together. So that's all I have to say. Sorry.
I want to talk more about pods. Do you have to go?
Oh,
okay.
No, I'm still here. I just didn't want to. I know you said you had a viewer question.
I do. I want to. Christy, do you want me to go? You know what? I want you to go, Christy, because it's a health question. So I want to. You go ahead and go, and then I want to hear. We'll ask the viewer questions about vaccines, COVID, and things like that. So I want our healthcare professionals to weigh in. But I've been asked to participate in a pod, so I really wanted to get some info. Maybe some other viewers out there are interested in how to do it safely. So I do want to get back to that. So go ahead, please, Christy.
That was what I was actually going to add. We, myself, it's my husband, my 2 kids. Just last night, my 9-year-old had a birthday yesterday. And so we've had consistent 3 other families that we get together with. They've been over to the house. They've come swimming at our house. Last night, we decided to go to a local snow cone place. We brought pizza. Everyone brought their own chairs. We met in a parking lot to just increase that socialization and choose those families that you trust. We are all working from home parents, and our children aren't interacting with other children. So we have kind of a pact where we understand we can get together. It's limited to those 3 families. Don't invite anyone else.
Yeah.
Those are just the rules of the game. And that's the engagement that we've had since March here in Texas. So it's worked well for us. And I foresee that we'll continue to do that into the fall. So that was just my ad for that. It is very much needed to find someone that you can interact with safely and just have rules of engagement.
Yes. Go ahead and ask the question, because the pod thing is something that we can
Carry
post
over.
something about, like the
Oh, that's
rules of
right.
engagement afterwards, because that's something that a lot of people I know are trying to do, or get together and have pods.
Right. Okay. No, that's a great point, Dr. Kim. So I'll just ask this question. Someone said they have a young daughter who's 22 months old. They're very cautious of new vaccines coming out. What are the pros and cons? I'm assuming they're saying of getting the COVID-19 vaccine whenever it's made available.
Mhm.
What are the pros and cons, and what should I look out for? All of our health professionals, please feel.
So, I mean, from a vaccine standpoint, I know the latest study that I had reviewed talked about the mRNA vaccine, and that in the way that would work, and how it would allow your own immune system to fight the virus. So, it's hard, because back when polio was going on, when our parents were younger, kids were dying, kids were becoming paraplegic, things were happening, and it was attacking kids. So there was no question when the polio vaccine came out that everybody got the vaccine. There was there were no anti-vaxxers back then. All of that was just a thing that you did. You got vaccinated, and then now we don't even get the polio vaccine because it's pretty much gone. But there's a lot of, I think a lot of healthcare workers are going to have to get the vaccine. It's like a lot of us are made to get the flu vaccine. We all have to get it who work in like hospitals and healthcare settings. I think most of us will probably, they haven't talked about a policy yet, but I can foresee that policy coming, that they're going to say we need and have to get that vaccine when it comes out. But Dr. Delaney and Dr. Contessa, what are your thoughts about the vaccine? Possible new vaccine when it comes?
Your real thoughts.
Okay, I'm gonna keep it real. I have always had a 1 year post-marketing rule. Even when H1N1 was added to the flu vac, I did not take it that year. I took it the next year. Just because, and I'm not an anti-vacciner, I believe in vaccines. My concerns with this vaccine is the rapidity at which it's going through the process.
Yeah.
And so I'm going to do my best to maintain my personal rule, because it has worked for me. It's brought me to almost a half a century of living. And so I'm going to continue to do that if I'm able to do that. Now, if my health center starts making some
mandate.
I'll sign the form for you. I'll sign the waiver for you. I got you, girl.
Thank you, Dr. Contessa. I'll hold you to that.
That's why I love Dr. Delaney, and she's always been a mentor to me. I love her to death.
Oh,
she keeps it real. She keeps it real. I agree. I think the issue for me is it's all about long term. So when they do clinical trials, even after something comes to market, there are post approval, like there's still studies that are happening, and so I want to see some of that post approval data. There are going to be enough people who are going to just going to be amped up to take it. That there should be some really quick data coming around. And so I would say 1 to 2 years, let's work out the kinks. Let's make sure I'm not going to grow a tail. No, I'm just kidding. No, I'm just kidding. But let me just, but for the people, yes, but I would say, but for all those
real side effects.
No, you're real side effects. But I would say the truth is, if you can just easily Google this, the top 10 causes of death in not only America, but in the world, 50 years ago, 100 years ago, and today. Infection was always, until vaccines came into existence, was always at the top of the list. Vaccines are literally the reason why our life expectancy is so long now. Infections killed everybody, this is how right now, why in such, and even comparing what happened in the 1918, what happened with the flu in 1918, and then what's happening now. If you don't get a handle on infection and you don't start those measures, then it will literally wipe out generations of people. So we do need to do something. And that is absolutely, a vaccine is going to be a game changer. But which one? I don't know. It's so many competitors right now. Everyone is racing to be the first one. And I feel like it's not an altruistic, who comes to market first. may not be all about altruism and all about
No.
quality. It may just be about some other things, mechanisms that I just don't know are happening behind the scenes. And so I just honestly, I just want to let the dust settle a little bit. Keep on getting the flu vaccine, because again, the flu compounded with, as our brilliant colleague said, not only coronavirus, but the regular old coronavirus, which is a cold.
Right.
All those things together, Lord, it's going to be a tough fall.
Well,
So get the flu vaccine. Get the flu vaccine. Get the flu vaccine. Don't even think about not getting the flu vaccine. Get the flu vaccine, please.
If you ever didn't think about getting it before, get it now.
Get it now. Yeah, Leah, can you weigh in? Leah's a pediatric nurse. Go ahead, Leah.
So my biggest concern, just from a health standpoint, is just looking at when they started creating the vaccine. We didn't even know much about the virus as they were creating this vaccine, and we keep learning things about the virus, especially in the pediatric population now. And so, is that virus going to be just for adults? Is it going to be for the pediatric population? Are we going to have two different vaccines for, certain age groups? And so I think those are all things that are important. And I think those are things that when we are thinking about getting the vaccine, when it does come out, you have to look at all those things.
This is really super helpful information. And I second everything you guys said, not mainly from a public health standpoint. There are a lot of things that people think about. I know I graduated undergrad in vet school from Tuskegee, and you harken back to the Tuskegee syphilis study and the propensity for those of African descent in this country to be leery, of the federal government and what they tell us to do. So those are also considerations that people that we need to think about. But I think the sound advice that you all have given about looking at the studies and asking, ask your doctor, ask your primary care physician. If you don't understand that, if that's not your lane, that's why people got the training in medical school, nursing school, et cetera. I don't know if there will be an animal coronavirus vaccine. Like there will be so much information out there. So please, pay attention to the news, but also go ask your doctor and talk to your doctor. Talk to someone in the health profession that you trust. I'll put it like that too, because we have to continue to build trust in this country based on the way some groups have been treated by the federal government. So
Absolutely.
that's just a fact.
So I did not realize what time it was. We run this for like an hour, and this discussion got so good because I think all of us have had this discussion with our own set of friends, and to get women from all over the country to be able to weigh in on what they're doing and why they're doing it for their families and for our kids is important, and it needed to be said. So many of us, that's why I think so many said, sure, I'll come on and talk about it, because all of us are thinking about the same things and having the same worries, the same fears, and then the same realities of what if, all the what ifs. So I thank every last one of you guys for coming on. It's just been a great discussion this Sunday afternoon. And I think, Dr. Priscilla, is there anything else that we need to discuss before we go? Because
No, we're gonna do this again because this has been really good. I mean, everybody who's come on today, we appreciate your background, your willingness to provide commentary, and what binds us all together is we're moms. Like, this is the real deal. Like, we signed up, we knew. We might not have known when we got pregnant with our first child, but we knew what we were getting into when we went down this road. And so, but we didn't think we would probably be here at this point, having to do all of this. So we have to use our voices as moms. We have to stick together, knowing that one decision, that we all have different decisions that we have to make, and we're doing, hopefully everyone's doing what's in the best interest of their family, but thinking about community at the same time. We're in this together. So it's the sooner we get this over with, the sooner we can go back to doing the things that we all love to do. So thank you all so much. We usually do our shirts. I'm not gonna do all that this time. I'll put it on the Instagram page.
Can I please share mine though?
Oh, yes,
Can I share mine super quick? Spread kindness, not germs.
And we'll end.
On that.
We'll end on that. Thank you all so much. You'll be hearing from us afterwards. Thank you so much. You guys have a great one. Thank you guys for watching MD plus DVM today. Please go ahead and subscribe to the channel and be looking out for more information from Dr. Kim and I. Have a great day, everybody.
Thank you.
Bye. Thank you. Bye-bye.